Hi, I'm Dr. Jarek Conrad. Welcome to Healthy and Black, where I share information about the state of health for Black America across 7 categories, from emotional health to physical health. I became plant-based over 15 years ago after losing so many of my family members to chronic health issues. Now I want to help you take control of your health. Welcome to Healthy and Black. I am excited today. This is my first guest. So I don't want to put any pressure on my first guest, but this is going to determine how the future of this show goes, how this conversation between us goes. So Dr. Hood is an honor graduate from Northeastern University School of Pharmacy in Boston, earning a BS degree in pharmacy. And then he enrolled in the UCSF Graduate School of Pharmacology and Toxicology in their doctorate program for a year before going to the University of California, San Diego School of Medicine, where he received his MD. After 40 years in medical practice in Southeast San Diego as a board-certified physician of internal medicine and in CareView Medical Group, he recently merged his medical practice with San Ysidro Health Centers. He co-founded and became president of an independent physician association, the Multicultural Medical Group, consisting of over 150 primary care physicians and 200 specialists. Dr. Hood has been an active member of CMA, AMA, the list goes on and on, the American College of Physicians, including being honored as one of their fellows. However, his passion for medicine has been expressed through his decades-long membership in the National Medical Association, serving as the president of the local chapter, then president of the state chapter in California. He served as the board chair, and he also served as the 101st president of the National Medical Association. And Dr. Hood, I knew you were a big deal, but I was a speaker at, this is last year, I guess, the National Medical Association meeting, and I was speaking to a section, and Dr. Hood was kind enough to come and see me speak. And we leave out of the session, and we're just walking around the hallways, and he's like a superstar. Everybody's like, oh, that's Dr. Hood. That's Dr. Hood. So I knew you were a big deal for sure after this NMA meeting that I attended. Dr. Hood is president of the Multicultural Health Foundation in San Diego. And you can reach them. You can go online. mhfwellness.org is where you can find more information about that organization. He serves on various boards, many focus on health disparities or issues affecting the Black community. Now, Dr. Hood, all this stuff is positive. I'm really, really impressed with all these accolades. And then something kind of slipped in here that doesn't fit. He remains socially active with membership in Alpha Phi Alpha fraternity. So we all get a chance to make a mistake. Nobody's perfect. That makes you human. Yeah, it makes you human. So, well, Dr. Hood, man, I am just again, I'm honored to have you as my first guest. You and I, we end up having these conversations about the issues that are plaguing our community. Why don't we get started? On Healthy and Black, we try to talk about the fact that, you got all these dimensions in health, and we've outlined 7 dimensions of health, but they're all intertwined. One affects the other. So today we'll focus on this combination of mental health and physical health and how they impact each other. If you can just give us a start by kind of laying the framework for how that combination has affected who we are as Black people today in America.
Yeah. Thank you, Dr. Conrad. I sent you my bio, but my expectation was that you were going to shorten it. But let me say this. Thank you for inviting me. It is my pleasure to be here. What you'll learn about me is I'm really passionate about this. I've been talking about this issue and researching this issue over the past 30, 40 years. And I grew up in the United States, born and raised in Boston, West Coast, and I got a Western culture education. And going to medical school, you never know that the mind and body are integrated
Mhm.
because the way they teach us in Western culture is they teach about the physical, then they teach you about the mental. And actually, in practice, uh, it's not well integrated. Uh,
Mhm.
as a physical uh, internist, I have very little interaction with the healthcare providers. Um, most physical providers, when they see my patient, will send me a report. Mental health providers very seldomly do,
Mhm.
or almost never do. So we've separated the mind and the body.
Mhm.
But what we know is that the mind and body are not separated.
That's right.
When the mind's in hell, the body's in hell. When the body's in hell, the mind's in hell. And
Yeah.
and and I know when I got my medical degree, they gave me a degree. They said, you got a degree in the art and science of medicine. And it took me 20 years to learn about the art.
Right.
And and so I started researching and in spite of how I was taught, learned to better integrate the mind and body and
Yeah.
how I see patients, how I treat patients. So an example is somebody gets a disease or especially something like cancer. Um, people's mind gets changed. Sometimes when you are having the primary issue of a mental issue, that can wind up in physical conditions. So they
Yeah.
actually are related. And so when you're treating somebody, you're thinking about somebody, I think you really have to address both aspects.
A question for you about that because it seems so obvious when you lay it out that way. Why is it, despite thousands of years where other cultures have understood this, why do you think we have gone about it a different way, where we've segmented these things, we separated them?
Well, I think it's because we have a sick healthcare system that's
Mm.
capitalized. So people
Mm.
make money off of folks being sick, and
Yeah.
people will put into compartments their area of expertise and learn how to capitalize on that. So the focus was more on uh, the science, but not the art of integrating that science.
Yeah, yeah, and certainly not a lot of discussion at all about prevention.
Yeah.
It's just-
Oh,
we,
not at all. And I think part of it was there is what I've learned is we we probably know less than what we don't know.
that's wise. A true expert knows what they don't know, right?
It's been portrayed that we know more than what we know. And,
Yeah,
and I think that's a dangerous thing. So I think learning about medicine and learning what I didn't know, and um, uh, and one of the things I think is important as a practitioner, any type of practitioner, when somebody comes to you for advice, is learning to say, "Here's what I know. Here's what I don't know. Here's what I
yeah.
think. Here's what I don't think." And then listening to that person, because many times they can teach you something that you may have missed.
Yeah, that is it's fascinating because we all get these titles as experts. So whether you're talking about the medical profession or whatever your chosen expertise is, there's some vulnerability in saying, "Hey, I'm not quite sure about that," or "I don't know that definitively," or let me go back and look at this some more. So for the people who are watching or listening to this podcast, it doesn't matter what your field of expertise is. It's really important that we're able to know what we don't know. I read a study years ago that if you take somebody who's an expert in something and they take a test on it, and then you ask them what's your confidence level and how well you did on that test, and you give a layperson who doesn't have that expertise, they take the same test and you ask them their confidence level. Well, the expert get most of the stuff right, but they think they got most of it wrong. The
Mm.
layperson thinks that they got most of it right, but they got most of it wrong. So it's just fascinating
Yeah.
how that works in our brain. So let's talk about today. some of the things that we do know, because there's a lot we don't know, but there's some things that we have learned about stress. And I
Mhm.
know early on in my career as an HR person, I would end up counseling somebody and they would be talking about stress. And I was a young person and I grew up in the projects in East St. Louis. And I'm like, just stress. Come on, what you talking about? You don't have no stress. And I didn't have a whole lot of respect for stress and what that meant until I started to learn more about the science of it. So talk a little bit about that. Like, a little
Yeah.
bit of stress is okay, but you got too much stress, you start getting into these
Yeah.
toxic levels.
Yeah, actually, stress is natural like breathing. We all
Mm,
experience stress. Actually, stress is necessary. Stress is a normal reaction to what happens in life and changes in life.
mm,
And as long as that stress is transient, uh, and you learn to develop coping mechanism, um, that's healthy stress that's
right.
teaching you coping mechanisms. What do I
Exactly.
mean by that? You go through a divorce. Uh, you go through driving on the freeway. Uh, you're getting married. You're getting divorced. All of these things can be stressful, but there's a beginning and there's an end.
Yeah.
The problem is what we call toxic stress, which is chronic. And that chronic stress is what's harmful,
Yeah.
especially if we don't develop uh, coping mechanisms. And
Yeah.
we're not always taught how to deal with coping mechanisms with chronic stress. And therefore, we develop certain behaviors that are unhealthy, drug abuse, alcohol, etc. And what we're now learning is that toxic stress over a period of time can have negative effects on our body because this toxic stress chronically is releasing these hormones and neurotransmitters and things that cause inflammation on the end.
Cortisol.
Yeah, cortisol,
Yeah.
epinephrine, uh,
Yeah.
those types of things. And then we can actually now measure it because
Yeah.
some of the secondary things to measure it is like um, uh, A1C, which is uh, let you know whether you're developing diabetes. Uh,
Yeah.
Cortisol is a steroid that enhances diabetes.
Yeah.
Uh, then we can measure your blood pressure because toxic stress releases vasopressors that cause your blood pressure to be higher. So, especially if you're under chronic stress, you can see you can begin to develop a lot of chronic diseases that ultimately damage your body, your kidneys, your heart, your liver, blood vessels causing strokes.
Which makes you stressed out even more, which makes you release even more of those toxins in your body. So you get caught up
Hmm.
in this cycle that unfortunately for too many of us, it leads to really devastating consequences. So now
Absolutely.
I say too many of us. So the show is Healthy and Black, but I got a lot of white listeners. I have a lot of people who tune in because they're interested in understanding, what are some unique experiences that Black people are dealing with. They might have people who work for them. They might have people in their families, and they just kind of want to understand. So, what you've just said applies to everybody. Anybody
Absolutely.
can be caught up in toxic stress, right? But think about all the stress that comes with life. Am I good enough at work? Am I good enough at home? Am I smart enough? Am I handsome enough? Am I whatever it is? Why did I become an alpha? You think you start asking all these all these questions. Um, Now add on top of all of that stuff that everybody deals with, this issue of race that's so loaded in America. And now
Mhm.
you're talking about a whole different ball game. A comment on that, Dr. Hood.
Yeah, so I think you're right. First of all, what we talked about is human,
That's
white,
right.
black, okay. However, certain races and ethnicity suffer with toxic chronic stress at higher levels and longer than others. And one of them happens to be African Americans, or what I refer to as American slave descendants.
Yeah.
uh, because I tie it back to a slavery.
Yeah.
Um, there's a hypothesis that I have, and I call it PTSD, post-traumatic slavery disorder. And what I mean by that is there's a epigenetic intergenerational discrimination that has caused this chronic stress that even today Black folks are kind of dealing with. And it doesn't have to be overt.
Mm.
Many times it's subtle.
Mm.
Many times you're the only
Yeah.
in certain situations, and nobody's calling you the N word, but you have to learn how to navigate that.
Yeah.
W.E.B. Du Bois called it in Black folks. He called it the Negro has a double consciousness,
Yeah.
and he had to learn to uh, deal with the perception that whites had of him as a Black, and those perceptions were very negative. And at
Yeah.
the same time, trying to be himself in Black. And that caused a conflict
Yeah.
because when you expressed how you really felt to contradict how they felt, it could put you in danger.
That's
It
right.
could put you in danger of being punished or killed or losing your job,
Yeah.
losing your status, uh,
Missing out on a promotion.
missing out on a promotion. So you had to
Yeah.
navigate America differently than white folks. Many white folks never got that. That's what I refer to as PTSD. Now,
Yeah.
that's being hypothesized, but there's actually evidence now coming out beginning to validate that with studies that are actually saying, well, is that caused by stress? And I think there's two components to that. One is called ACEs.
Mm-hmm.
It's the adverse childhood events.
Mm-hmm.
Here in San Diego, I think it was 1998, there was a physician at Kaiser that did a ACE study. That's the adverse childhood events. And it included thousands of patients. Most of them were white, but a subgroup of Blacks and Hispanics. And
Mm-hmm.
basically, by measuring adverse childhood events, negative events that happened during your childhood up until about 18, such as physical abuse, emotional abuse, divorce, alcoholism in your family. And the more of those negative things you checked, there was a direct correlation later in life of chronic disease,
Yeah.
asthma, hypertension, depression. And it's
Yeah.
been proven by multiple other studies. Well, what was interesting in that study, guess who had higher ACE scores than all other ethnic groups? African Americans.
Exactly. Exactly.
Okay. And the other is what we call allostatic load.
Mm-hmm.
Allostatic load is the measure of this toxic stress. So now they took groups of folks, Blacks, Hispanics, and they're measuring these biomarkers for toxic stress, epinephrine, cortisol, indirect measures such as A1C. Guess who had higher levels of these biomarkers under the same stress as other groups, African
Yeah.
Americans?
Yeah.
And and so this, in my mind, explains why African Americans have higher issues with hypertension and cardiovascular disease. I'm not saying that's the only contributor,
Yeah.
but
Yeah.
it's a significant contributor.
Yeah. So if I'm hearing you right, a practical way to explain that is, if I'm doing the same thing that you're doing, I'm Black, you're white, we're eating the same way, we have the same level of physical exercise and all that. However, I'm scoring high on
Right,
these two assessments.
right,
I'm more likely to develop some chronic health issues as a result of that because of the effect of that stress that
exactly.
that is my body is going through. Dr. Hood, I wrote about this similarly. I say we always, we're on the same page. So I think my first book, The Fragile Mind, came out, I think it was 2008. I
Mm,
talked about persistent traumatic stress,
mm,
persistent traumatic stress.
mm,
And I was describing more from an environmental standpoint, growing up again in the projects in East St. Louis and seeing things that a child not is not necessarily supposed to have to deal with, like seeing somebody get shot in my house.
Wow.
for instance, and
Mm,
having to cope with that. And I talked about it's different from a war zone in the sense that, you go to a war zone, you serve your term, you typically come back. And we're just now starting to deal with the issues that our soldiers experience who go and experience, again, stuff that we shouldn't see. But
mhm,
when you're a little kid, you don't get to go and, come back. This is where you are. And
mhm,
so I called it persistent traumatic stress.
mm,
So there is something to that. And I'll tell you what kind of led me down that path. I saw a speaker years and years ago, before I wrote the book. It was talking about infant mortality. And it
mhm,
was actually a researcher, I think, from UCLA. And, doctors forever have been trying to figure out, why is it that Black people have such worse outcomes related to infant mortality? Why are Black mothers struggling so much? Even when they go to the doctor, they take care of themselves, they take prenatal vitamins, they do all this stuff. Why is there still such a disparity in birth outcomes or kids living to 1 years old? And they tied it to stress.
mm,
This is the stress of being a Black woman in America that impact those chemicals that you talked about.
mhm.
That's going in the body, that's impacting the womb. Kids are, being exposed to these levels of stress before they even open their eyes. So
Sure.
it's
Yeah,
fascinating.
absolutely. If you want to really see the impact that this toxic stress has had, you look at the beginning of life and the end of life.
Yeah,
Beginning of life, infant mortality, African American babies have the highest infant mortality rates going back 100 years.
yeah,
Okay. But not only that, maternal mortality rates, the
that's true.
mother dying. Even today, Black mothers die in relationship to birth more so than any other group. And it crosses economic status.
That's right. That's the
Okay.
that's the fascinating
So
thing.
so even blacks who have made it, yes, they're better off, but they're still not equal to health-wise as their white counterparts. And then you go to the end of life. Blacks' life expectancy is less than any other ethnic group. Okay.
Yeah,
And the
yeah,
only one close to it is the Native American.
yeah,
Okay. And I look at it like I said, intergenerational trauma. The two groups in this country that have received the worst treatment intergenerationally are the Native Americans and the Blacks. And both of them have similar health outcomes that you're
yeah.
describing.
Yeah. And again, well, you could say, oh, this is correlational, but we're starting to uncover the exact reasons why this is happening. So it's just a fascinating thing to think about.
There's another study I read about telomeres. Telomere is
Mm,
a portion of the gene that um, it's an indication of longevity.
yeah,
So those who telomere shorten quickly die quicker. And they see that Black folks' telomeres start out the same, but through
yeah,
life, the telomere gets shorter. And what shortens that? Stress, hormones, inflammatory issues. So
yeah,
it's real.
yeah.
It's not, it's not genetic. They used to propose
Right.
that there's something genetically um, there must be a disparity gene for Black folks. The
Yeah,
disparity gene for Black folks is called racism.
yeah, yeah. No, it's fascinating. I want to point. I want to go back to this point that you made about, it's not a class issue, it's a race issue. It's not just a class issue or economic issue, because we're seeing, again, very, very similar outcomes across these groups. Let's talk more about that. What? How can that be? Wait a minute. I have some money now. I live in a different
Mhm.
neighborhood. I
Yeah.
can eat what I want to eat. I got a membership to the gym. I got a little treadmill in my house or whatever it is. I'm hanging out with my friends. We're having our wine together. I'm doing everything that they're doing. Why am I not having the same health outcomes?
Yeah, and I think a lot of it is what we're talking about. The other way I put it is first on they when they first started seeing this data, they attributed to quote social determinants of health, like
Yeah,
folks who lived in certain zip code areas
environment.
that were poor, your environment, what you ate, etc. Absolutely contributes to it.
That's right.
But in the African American community, you'll see that a lot of that was racialized.
Yeah,
I call it racialized poverty uh,
yeah,
that came about in this area. But now, if you look at, but they say your zip code is more determinative of your health outcome than your genetics.
yeah,
If you look at data like in Southeast San Diego, where you have significant Hispanic, significant Black, significant Asian. So it's not just like places back east, like one area is all Black and whatnot.
yeah,
And that's a poor area that has a low life expectancy. If you look at the different ethnic groups within that area, Blacks' life expectancy is still lower
still
than
lower.
Hispanics. As a matter of fact, the Asian life expectancy is greater than the whites,
Yeah.
and the Hispanic life expectancy is greater than whites.
Even in those poor neighborhoods.
Even in those poor neighborhoods. And
Yeah.
and 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 so something else is going on.
Yeah. I think, again, from a practical standpoint, you and I have talked about this, as esteemed as you are, as much as you have accomplished, if you put on, a t-shirt and some sweatpants and you and you drive around, if you interact, whether it's a racist police officer or a racist store manager or whoever it might be, when they look at you, they don't see Dr. Hood, the 101st president of the National Medical Association.
Right.
They see a black male. And whatever they think about black males, they're going to attribute it to you. They're not going to interview you to say, well, tell me what your income level is, what your education level is. Should I discriminate against you? No, you're going to go in that box. And you know that. And
Correct.
so, because you know that, as you mentioned early on, it doesn't have to be direct or overt. It can be just you knowing that adds a level of stress. Just navigating routine things
Absolutely.
in life. It's
Absolutely.
fascinating.
And it gets to the point you don't even think about
Yeah.
it. Okay. You
Yeah.
don't know it, you're thinking about it, but it's like, and the older you get, what is interesting is there's a somebody once said, well, can you measure this? There's a atherosclerotic cardiovascular risk calculator that's
Mm.
been put out there by the American Heart Association and the Association of Cardiologists. And the first one that came out was based upon the Framingham study, which was a study done back in Framingham, Massachusetts, some 60 years ago, saying the number one cause of death in this country is cardiovascular disease, and they wanted to know why.
Yeah.
So they looked at that population. It was 99% white,
Yeah.
and they identified the risk factors. That's why we know the risk factors today: high blood pressure, diabetes, cholesterol, obesity. Those were
Yeah.
the risk factors. Then, about 8, 9 years ago, they updated this calculator to say, well, what if we put race in there? And
Yeah.
now the calculator will look at um, um, whites, blacks, and others. So I have a patient who is African American male. This is a real male who had a blood pressure of about 160 over 90. His total cholesterol was like 230. And I put all these numbers in there, and it said his risk of having a cardiovascular event in the next 10 years was something like 25%. Okay.
Yeah.
I didn't change any number. I just changed him to white, and it went
Yeah.
down to 15%.
Wow.
What
That
is that
dramatic.
measuring? What is that measuring?
Yeah.
I then went to female, and the white female went down to about 12%, but the black female went up to 27%.
Wow.
Okay.
Wow.
And I asked all my colleagues, nobody could really answer that. And I think this data coming out now suggesting this chronic stress and allostatic load has something to do with that.
Yeah. So this is fascinating. I mean, and look, we don't want to depress you if you're watching this. And so we're going to talk about like what can we do, that what is in our control. But I do want to talk about one other thing from a medical professional standpoint, and that is the difference in treatment. And I know we could probably spend another 30 minutes, another hour, we're talking specifically about that. But I just think it's important for our listeners to know that not only are we experiencing these things, at a higher level, these chronic health issues at a higher level, partially caused by this toxic stress, but when we go seek help, we're treated differently as well. And so, in terms of the types of questions, what the interaction is with the doctor, what treatments are offered or not offered, Dr. Hood, can you talk just a
Yeah.
little bit about that?
Well, first of all, let me end up, and I think you're right. We need to get to something positive. However, my issue with the youngsters today, they always want to jump to the solution and something positive. That's why none of the solutions work.
Yeah, yeah,
Okay. The best solutions are based upon knowledge.
yeah,
Okay. And so it's like when I talk to my cancer patient. Okay. You can't just jump and say, okay, we're going to cure this. Don't worry about anything. No,
yeah,
there's a lot of trauma and turmoil and things that they need to know and go through that are not very pleasant. And that's where we
yeah,
are now.
yeah,
There are some solutions, but I think the solutions will be better once when you understand that. And
yeah.
yes, you're
Agreed.
right. Black folks are treated differently in our healthcare system. That's not a statement, that's a fact. It's a statement of fact. And I'd like to take some pride in myself and the National Medical Association highlighting that.
Yeah,
Because in the late 90s, there was research articles coming out in the journals pointing this out. Blacks were blacks were going to the same physicians and things were being done differently for the whites than the blacks, more therapeutic for the whites than the blacks. Blacks were getting less pain medication. And the initial response was, well, it must be a communication problem. Uh,
mm,
it must be an insurance problem.
mm,
And it was the National Medical Association said, no, there's more to it going on. There's something, there was an entity called the Institute of Medicine, now the National Academy of Science.
mhm,
What we learned was that Congress, when they want a question answered, sometimes they'll go to the Institute of Medicine and say, could you study this for us? The NMA recognized that. We went to the Congressional Black Caucus and said, hey, we think the Institute of Medicine should do a study looking at these studies coming out. It was Jesse Jackson Jr., when he was in Congress at that time,
mhm,
helped lobby the Black Congress. They got Congress to put up approximately $1 million for a study called Unequal Treatment.
mm,
It was only done at the advocacy of the National Medical Association. That was published in around 2001. And what it showed, it looked at hundreds of data, and the conclusion was racism in medicine is real.
yeah.
It's not just social determinants of health. And subsequent to that, there are many articles pointing that fact out.
And we're some, 23, 24 years later. And to your point, a lot of people don't even realize this. And if you start having this conversation and all of a sudden, oh, this woke, 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 we can't even agree on the historical things that have happened so that we can get to a point to talk about the things that are happening today. If you even if you erased some of that history and you just talked about, well, what is happening today in terms of treatment and resources and access and all of that, we still have a bunch of issues. And so we got to figure out ways. That's one of the reasons I'm doing this podcast. We got to figure out ways to blend both the science and the practice for people to understand this stuff. As we start to shift into, okay, well, what can be done? On the one hand, people should be happy that we have folks like Dr. Hood that is going to speak up, that is going to make sure that he is advocating for our interest and is not afraid to say the thing that needs to be said. So there are people like Dr. Hood in many communities who are desperately trying and have been trying for decades to change the systems and structures that produce the outcomes that we're experiencing. So that's on one hand. For people who are listening to this podcast who are not in the medical profession, who are just trying to figure out what about for me and my family, what can I do? Now, of course, I've already been talking to everybody about plant-based nutrition. In fact, I have another guest that I'm lining up who talks about slave food. And so that should be a great conversation. So,
Yeah.
yeah, what else, Dr. Hood? What can we do, man? You've just told us that
So,
we're less likely to live as long as our counterparts. We're experiencing these chronic health issues at a higher rate, even if we are here. So our quality of life might not be the same. What do? We throw up our hands?
so I say we have all those things, those bad habits that we had in the past. That was part of our survival mode. How do we get to the thriving mode?
Yeah,
Okay.
yeah,
We survived for a long time, but we're not always thriving. So how do we
yeah,
thrive? Um, and Dr. Conrad, you're right. I don't think you can talk about nutrition enough. Okay.
Some of my listeners might not agree,
No,
but
I don't think this is somebody who still eats meat. I'm not a vegan. Okay. The health profession has gone all the way around. Most knowledgeable health professionals will tell you the best diet is a plant-based diet
yeah,
for all kind of reasons.
yeah,
Okay. A lot of the chronic diseases, and that type of thing. Um, I often say for some of us old folks, I'm not saying it's too late, but for most of us it is. We ain't going to change. Okay. But how do we start teaching our youngsters better eating habits?
yeah,
So you asked, what can we do? I think that type of thing, getting better foods into the schools,
yeah,
into public arenas, and having folks teach you how to cook it and eat it is critical in what we're talking about.
yeah,
I read a book one time. It said, "You are what you eat."
yeah,
Okay,
yeah,
and,
yeah,
and so that's critical. However, we also have to get more mindful. Okay, and we have to start practicing more mindful habits.
yeah,
Uh, that stress reduction, um, meditation, yoga, just taking time for yourself, reading, whatever makes you relax. Like my wife introduced me, and don't tell her this because I haven't told her I do it yet, is this calming app
ah,
at night
ah,
that kind of helps you sleep. I found that I
yeah,
get better quality sleep when I do that.
yeah,
Reading things that I like to read. Doing like I started getting off, I don't want to say gardening, but more about trying to grow things.
yeah,
So I think we have to find more things that tune us into our body and our mind in nature that relieves us from the toxicity that's going out in our environment, along with the usual, exercise and uh, uh, enough sleep, etc. Um, uh, the other is sometimes I think, how can we get the youngsters to listen to the older folks more?
yeah,
What do I mean by that? Data shows that stress, that toxic stress, is actually less for older Black folks than it is for older white folks.
hmm,
And what that tells me is that if you're lucky enough to survive beyond the usual age that Black folks live, you've learned resilience and coping mechanisms.
yeah,
Okay? How can we take what we learned and get folks to learn some of those coping mechanisms sooner.
Yeah.
So I don't know if I'm making sense.
Yeah, you are. I mean, wisdom. You're
Yeah.
talking about wisdom. I mean, we know that older folks have a higher degree of emotional intelligence as well. Part of emotional intelligence includes the mindfulness. You have this reservoir of experiences. So when you're confronted with something, I've seen this before. I don't have to panic. I know what this is. I've
Mm,
gotten through this before.
mm,
Here's what I did to get through this. I survived. I will survive again. And
mm,
so, there's a level of maturity that comes along with that. I think the average age where we kind of peak in our emotional intelligence is something like 65 years old
mm,
before we get to the point where we feel like we got this thing down.
mm,
So that's something to think about. I will just hone in a little bit more on mindfulness
mhm,
and uh, for people to understand what that means,
mm,
and mindfulness, I mean, it's a deep it's a deep concept to get to because what it implies is this level of awareness around what my emotions are telling me, so that my stress level is starting to build up. I think about stress in two aspects: a stress tolerance level. So kind of like that load you talked about. Like
mm,
how much stress can I take before I get to my breaking point? And then an impulse control. So what does it look like when I get to my breaking point? So
mm,
from an emotional intelligence standpoint, we like to look at both of these. Some
mhm.
people have a long, stress tolerance, but once they get there, you have to watch out. Some
Yeah,
people have a very short fuse, but when they get there, they're not going to tear anything up.
right.
And some people both, one or the other. So I think for people who are watching or listening to this, really tuning into at any given moment, can I articulate what I'm feeling, why I'm feeling this way? If I'm angry in a situation, what is at the core of it? Why am I getting
Mm,
angry at it? Because oftentimes it ain't about the person that we're angry at. It's about something going on within us
right.
that this interaction with this person just kind of brought it out, right?
Mm,
It's things that we don't want to deal with. So really, really invest in, mindfulness and just trying to
yeah.
understand, practice
And
articulating what you're feeling.
yeah, I think you're right. And I like to say, in our society, we're so individualistic, and we're talking about you need to figure this out yourself. You won't.
Yeah,
It took
yeah,
people to bring you here. It's going to take six to carry you away. And
yeah,
so part of this mindfulness is who you associate with. You you
yeah.
you you've got to have people to be able to bounce things off. The way sometimes people talk is, well, you need to do this, you need to do that. Well, what you need to do is also do it with other people. Okay.
Yeah,
We when and I found like during the COVID evidence showed that isolation, really we saw mindfulness deteriorate. Okay.
yeah.
Because the interaction that we need with other people. So I think your toxic level goes down. If you hang around a lot of toxic people, it's going to be hard for you to practice mindfulness.
That's right. That's right. There's data on that. We talked about longevity and lifespan and all that, and all the research says that relationships are critical to living a long life and to having a quality of life, along the way. Like good news is, we're to your point, we're starting to invest in the kinds of studies that's getting us closer to some information that we can do something with. The challenge is, how do we help people take that information and translate that into something meaningful for their lives? So
Yeah, yeah,
that's our quest.
yeah. And I think men, especially men,
Yeah,
are not as likely to kind of seek help
yeah,
as women. And so I encourage that. Yes, if need be, a professional recommendation to a behavioral health, but a friend, a
yeah,
family member, your pastor,
yeah.
or those types of things can be just as helpful. But you need to be able to reach out and don't just keep it in.
Absolutely. I will echo that. We got to be able to share this information. And I found through certain groups that I'm in now, whether it's the Kappas,
Mm.
I'm finding people being a little bit more willing now
Right.
to talk about those things. So I think we're going down in the right direction. Well, Dr. Hood, look, man, I'm going to have you on again because there's so many other things that we can talk about, but I can't thank you enough for coming and talking about these very important issues for the people who are tuning in to this show. I always say, don't let culture, cost, or convenience ruin your health. We're talking about these cultural aspects now that are really important in that whole equation. So
Mhm.
thank you again. Any parting words that you want to leave with people before we go?
No, first of all, I want to thank you, Dr. Conrad. I really feel honored that you asked me to be here. I think what you're doing is very important for our community, especially in these very, I think, toxic times. So thank you.
Take care, everybody. Thank you for tuning in for this episode. And I'll repeat again, don't let culture, cost, or convenience ruin your health. Thanks for joining me for this episode of Healthy and Black. I'm your host, Dr. Jarek Conrad. If you have feedback on today's episode, please email info@jarekconrad.com. I'd love to hear from you. Don't forget to visit jarekconrad.com to subscribe to my blog. Thanks for listening. Please tell your friends about the podcast. Until next time, don't let culture, cost, or convenience ruin your health.